Hello viewers, welcome to the postgraduate diploma in environmental and occupational health. I am Prof.B.Rupini, program coordinator of the postgraduate diploma in environmental and occupational health. Today we are going to discuss about the course MEVE 002, that is a healthcare sector. So far we have studied about the lots of hazards that are come across by the healthcare professionals. So as a part of that one, today we are going to discuss about the physical hazards which are come across by which are faced by the healthcare professionals, especially in the healthcare sector, that is our hospitals or the nursing homes, and then laboratories as well as the testing units. So today we are going to discuss about one of the important and major physical hazards which are faced by the healthcare workers in the hospital sector, that is the radiation hazards. So radiation hazard, we have considered the physical hazard. So today we are going to discuss about what is exactly the radiation. So the ionizing radiation from X-ray machines. So the ionization comes from the X-ray machines and also fluoroscopes and also computed tomographies which are used for the diagnostic as well as the therapeutic procedures and image guided procedures and cardiac that is a catheterization and angiograms and pain management and also other and some of the other examples are highly hazardous in nature. So therefore it is a non-powerful enough to cause the ionization, that is the removal of electrons as the scientific terminology is concerned of the molecules. So the ionizing radiation is routinely used in the medicine or the medical field. The occupational health and safety of the hospitals, they provide the information, that means normally they will have the e-tools. So they will provide the information about the protecting the hospital workers, that is the healthcare workers, from the radiation exposures. They have the authority over the non-NRC which are regulated medical uses. So they do not involve the use of radioactive material directly, that is those involving radiation that does not come from the NRC regulated radiation sources like diagnostic or the imaging techniques, that is examples like radiography and computer tomography, CT as well as the fluoroscopy. They used to normally to locate fractures and growths and tumors that determine the extent of an injury or disease and determine the necessity for other medical procedures. So these are the used. And the second point is the interventional techniques, that is for example fluoroscopically guided interventional procedures as well as the angiography which are used to guide the treatments. And radiotherapy is also there, that is used for treatment of disease like cancer. Radiotherapy is also known as the radiation therapy that involves the use of the high energy ionization radiation to kill the cancer cells and also the shrink to, that is diminish the tumors especially. So non-NRC regulated radiotherapy is the use of X-rays as well as some of the accelerators. So many hospitals, they have the different technologies and also they have the other regulations to use this one. As far as the medical imaging is concerned, many different technologies of which they have some examples I would like to give. A portable fluoroscopy machine that can be used to guide the cardiology, and they used to be the guide to the neurology and also other procedures. If you will look into the radiography, it is typically conducted in a radiology department through either a central department or satellite facilities, but they may be performed in certain doctors or officers or especially the orthopedic department or orthopedic doctors. The radiographic equipment, especially they will fixed, and mobile radiographic systems are also there. That means there are varieties of radiography systems. So most medical facilities, they will use the digital radiographic equipment that produces digital images instead of X-ray films. and also this technology typically reduces the radiation dose workers and patients receive. So this is also one of the most major technological advancement, we can say that. For examples I would like to give, the next one is the computed tomography, CT, normally we can call it as CT. So they will call it as a CAT scan. So that involves using one or more X-ray beams to acquire images of one or more body parts from different angles around the patient. So because they generally involve many scans, that means only not in the one particular direction, they want to have the 3D, that means all areas and then all angles, we can say that. So because they generally involve many scans, CT procedures, and also associated with higher radiation doses for the patient and also high radiation hazards for the workers when compared to the general X-ray equipment. So the patient dose from a CT scan depends upon the part of the body examined and also the protocol of the CT. And then if we will see the fluoroscopy, so it is a continuous real-time X-ray image. So it is just like an X-ray movie that can be used to monitor the movement of the body parts as well as the objects or the contrast agents throughout the body. So it can be performed with the fixed or portable fluoroscopy systems, some fluoroscopically guided interventional procedures that have the potential for high radiation doses, like most interventional radiology, interventional cardiology and interventional neuroradiology procedures as well as the endovascular surgery. So when fluoroscopy requires higher patient doses for long period of time, it may result in increased risk of the deterministic effects like cutaneous, that is a skin radiation injury, like that. So employers should ensure that fluoroscopy workers receive appropriate training and also the information about the radiation hazards and also the probability of deterministic as well as the stochastic health effects. So the FDA also provides information about the fluoroscopy devices and their uses. So proper training is highly required for the technicians, those who are using the fluoroscopy. And the next one is the cardiac angiography. That means all these emit the radiations. They use a specialized form of the radiography, that is for the angiograms, for heart catheterizations, and that may include the angioplasty, that is a procedure. Normally it is used to open clogged arteries or the blocked arteries, and stent placements, and is often a fluoroscopically guided interventional procedure. So it involves the radiography of blood vessels after injecting a special type of dye to increase the X-ray images. So cardiac angiography, that will both a radiation dose from the fluoroscopy as well as the radiography. And another equipment, normally this radiation is come across, radiation is emitted, is a dental imaging. They use the special dental X-ray machines. Definitely they will produce either digital or film images, and is typically performed by the dental doctors or the dentists or dental or the officers. So there is a new technology also came, that is mainly that is the cone beam computed tomography CBCT scanner. So it is used for the more complex oral and also the maxillofacial, that is a JAS, as well as the face imaging. So the employees should ensure that protective measures like safety positioning, the dental X-ray equipment, operator relative to the X-ray equipment, it is more important to keep radiation doses for the dental workers and also the to minimize the risks. So how to control this radiation hazard, especially in the healthcare sectors? So we will see that the range of non-radiological safety and health hazards for workers in the occupational settings with ionizing radiation hazards. For example, these non-radiological safety and health hazards are electrical hazards from associated with the electrical equipment, which we have already discussed in the previous class. So, and then also laser hazards, if lasers are incorporated into this one. If we will look into the radiation prediction programs, So developing and implementing a radiation protection program is the best practice for the protecting healthcare workers or the healthcare professionals from ionizing radiation. So a radiation protection program is, especially if you will think that there is a protocol, that means usually managed by the qualified experts. Who are the qualified experts? That is a health physicist, or the healthcare professionals, or the healthcare technicians, especially those who have got the training and studied about this type of radiations. These people are collectively called them as radiation safety officers, RSO. So and also the another best practice, if we will look into that, is the designating a radiation safety committee. So that means the one RSO, that is a radiation safety officer, should be there as one of the member in that committee, and also a management representative, and also workers, those who are working with the radiation producing equipment and radiation sources or radioactive materials. That means those who are otherwise at risk of exposure on this job. Program, what the program indicates. So what are the criteria? So what it will do? So that means first one is that committee will do that equipment registration as well as the licensing part. So they require some types of radiation producing equipment or the radiation sources. So the registration or licensing requirements that apply to many specific radiation sources, and also the occupational settings like medicine, manufacturing and construction. So the equipment registration or licensing that helps to ensure that radiation sources are, especially the emitting ionizing radiation, that do not pose radiation hazards for the workers as well as the general public, those who are associated with them. And some of the radiation sources like most X-ray equipment and some accelerators, we can say that they must be registered with the agencies, that is state radiation control agencies are there, state health departments are also there, or the local agencies, that is a health department, and also different registration requirements that may apply depending upon the agency. So the registration may be required to perform equipment tests and also to allow the local inspectors to perform the equipment test. And also in some other states or some other organizations, the equipment registration requirements may be regular inspections as well as shielding, or otherwise we can say that the signage. So for that, those who can associate with this type of inspectors, that is the first one is the qualified staff, that is the RSO or the health physicist, to provide oversight as well as the responsibility for the radiation protection policies as well as the procedures. And also the as low as reasonably achievable, that is the ALARA, is also a guiding principle, that is a radiation protection which is used to eliminate radiation doses that have no direct benefit. And also another program, that is a dosimetry program, which is with the personal exposure monitoring, which is conducted as required by the state regulations or the external doses, and also which is needed for the internal dose for the especially the healthcare professionals. And another important program is the surveys as well as the area monitoring. So this documentation procedure is highly required and also highly important for the radioactive materials as well as the contamination and also the potential worker exposures. That means that database should be there with that radiation policy managers. And also the radiological controls, how this will carry out this radiological controls. So that means the entry part as well as the exit part of the controls, and also the receiving, inventory controls, storage as well as the disposal. So the another part is the training part. That means the workers, those who are associated with the radiation as well as the ionizing and non-ionizing radiation equipment are the radiation protection. So the radiation protection that includes the health effects which are associated with the ionizing radiation dose, and the radiation protection procedures as well as the controls to minimize the radiation doses and also the prevent the contamination. And the other procedures are also there. There are so many number of procedures. I would like to emphasize only few of those procedures, like the emergency procedures to identify and respond to the radiological emergency, as well as the situations, as well as the occupational safety and health, that is a radiation emergency preparedness, and the response page especially that provides the information about the radiation. And record keeping and reporting programs are also most important, where the entire program to maintain all records and also provide the dosimetry reports and notifications which are required by the state radiation board control, as well as the regulations which are prescribed for the healthcare workers. And finally, I would like to emphasize on, along with this record keeping as well as the reporting programs, that is the internal audit procedures. So in the internal audit procedures, the trained workers should be there, and also the annually audit all the aspects of the radiation protection program, and also the most important radiation protection programs as well as the regulations should be properly made and apply to some specific radiation sources as well as the occupational setups. And the Occupational Safety and Health Association, the ionizing radiation standards, they will apply where they are not preempted, and also in those cases they require certain elements of radiation protection programs. And a key concept which is underlying radiation protection programs is keeping each worker's occupational radiation dose, that is also most important, as low as reasonably achievable, that is ALARA. So it is a program especially involves the maintaining radiation doses to workers as far as the state regulatory occupational dose limits are concerned, and reasonably achievable, that is taking into consideration of the state of technology, economics as well as the social factors. And also along with this ALARA, these procedures are typically developed for working with the specific radiation sources, like diagnostic radiography, like medical x-rays, or the fluoroscopy in medicine, or industrial radiography. And also another criteria is time, distance as well as the shielding. So when it comes to the ionizing radiation, one has to understand, one has to keep it in mind that the time, distance as well as shielding. And then how to manage the time, that means minimize the time that spent in areas with elevated radiation levels, and also minimize the exposure time that reduces a worker's dose from the radiation source. And another one is maximize distance from the sources of radiation. That means the worker, those who are operating, or the technician, those who are operating the radiation equipment, the radiation dose decreases as the worker's distance from the source increases. For example, the gamma rays are there. So the gamma rays and X-rays, the radiation intensity is inversely proportional to the square of the distance from the sources, that is the inverse square law. So that means increasing the distance by a factor of 2, that decreases the dose rate by a factor of 4. And also use the shielding for the radiation sources. That means the placing an appropriate shield between the source of radiation as well as the workers. That means inserting the proper shielding, like it may be a lead or concrete or any special plastic shields, that depending upon the type of radiation between the worker as well as the radiation source, that definitely will reduce or diminish. Sometimes it may totally eliminate the dose received by the workers. And also the some protection are the engineering controls. If as far as the management hierarchy is concerned, there are elimination is also there, as well as especially for this radiation techniques, the engineering controls are most important. So the engineers are the controls to maintain the occupational radiation doses. For the especially the greatest evidence are the greatest extent possible, the administrative controls not being used as a substitute for the engineering controls, because engineering controls in some cases they may be incorporated into in the designing stage itself, like shielding and the interlocking systems. Apart from this, the radioactive material is concerned, the contaminants is sometimes incorporated into shielding, like gamma cameras, and used for the nuclear medicine or industrial radiography devices that containing radioactive sources. And also shielding is also most important. That means it needs type of the activity of the radiation source. Use in the adjacent areas, like areas above and then below of the rooms or the facilities, are associated with the patient or associated with the technician. For shielding of the rooms containing the medical X-ray equipment or which are medical X-ray imaging devices, they recommends that the shielding design goal should be, that is of course in any of the 500 radiology, that is normally in terms of the radiation is concerned, in a year to any person in controlled areas. For uncontrolled or the unrestricted areas, so this recommends that the shielding design must be maximum of the 100 points, we can say that, into any of the person into a year. So the design requires a proper relocated equipment and also qualified expert that should contact an area survey and also evaluate shielding to verify whether the radiation protection behind shielding is there or not. So before performing any room modifications or any changes that occurs in the facility, that definitely changes in the radiation exposures. Apart from all these equipment as well as all these protective measures, so another important factors I would like to emphasize is radiation survey instruments that can be used to evaluate exposure rates as well as dose rates and also the quantities of the radioactive materials for the contamination. So the survey, almost the instruments that must be appropriate for the type as well as the energy of radiation being measured. So that means a qualified expert should be provide oversight for selecting appropriate area survey and the instruments and also the survey instruments properly when conducting the area survey as well as the monitoring. So dear learner, so we are coming to the stage of conclusion of the physical hazards which are faced by the healthcare sector. So healthcare sectors, in the healthcare professionals like doctors, nurses as well as the technicians, those who are using the radiation machines should strictly follow the guidelines as well as the control as well as prevention measurements of the hierarchy, that administrative controls as well as the elimination of the hazards and also the proper training of the technicians, those who are operating especially for the radiation technology. So I would like to thank all the viewers that you must have benefited with this lecture. So in the next class we will come up with some other interesting factors. Thank you.